Hey everybody. I hope you guys had a great weekend. Mine was awesome. My last video, I talked about the difference between a late admit onto hospice and an early admit onto hospice and how that affects the family and the patient, the hospice workers, and then even in some cases, the facility workers. And so, I really stress the importance of giving the families and the patient enough time to process what's happening and really what the heart of hospice is so that they can make that death or that passing or the graduation off hospice something really memorable and a positive experience. Even with loss, it can be a beautiful experience. But now you know when to admit them, but do you know what we look for? Like the indicators that we look for? I'm going to tell you some of them. They're non-disease specific, and they're just indicators. I have a little list of things. It's not with me, so let's see how much I can remember, okay? Each disease process, like heart failure, COPD, or dementia, or ALS, Parkinson's, these different diseases have certain qualifications to meet Medicare guidelines, but there are some non-disease specific things that we take note of, okay? One's weight loss. Because just like in one of my other videos, I talked about how the body, as it starts, shutting down, people lose their appetite. They just lose that need, that hunger, and so they'll lose weight. In some cases, they don't, and so we're always checking a MAC score, their mid-arm circumference, because even if their water fluid's not going in the right places, if they're losing some weight or their body's kind of starting to shut down, you'll see some sunken in cheeks. You'll see this is decreasing. You'll see an increase in fatigue or weakness, a decrease in function, sometimes a decrease in cognition. You will see worsening wounds if they already have them, and they're getting great wound care, but they're still not healing. They're not doing well. That's kind of an indicator. See another one. Let's say they used to be kind of a standby assist. They just had someone walking with their walker, and now they're like a maximum of one, or even a Hoyer lift. Some new incontinence, frequent ER visits. So they're going back and forth, or whatever disease process they've got. Let's say that they have some heart failure, and they're trying everything they can to make that fluid go in the right spaces. So they'll give them a diuretic and their kidneys are upset. Or they give them a diuretic and then they're having orthostatic hypotension, right? Worsening vital signs. You're just going to see an overall presentation of a person getting weaker. Increased hours of sleep is a big one too. These are really important things to be looking for. And the reason why I'm bringing them up are just so that you can have them in the back of your mind. So if let's say you're a floor nurse and you see Judy coming in and you see her one day and you say, hey, Judy, how you doing? You fix her, right? You fix her and then you send her off her way. And the next time you see her, she's gotten a little bit worse. And the next time you see her, she's gotten a little bit worse. Have that in your mind to talk to her about what hospice offers. What's her home like? Who's helping support her? Who's taking her to the bathroom? And so those things can be really helpful to just have in the back of your mind and have a good conversation starter with them. How are you doing at home? Last time I saw you, this is how you were. Do you think you're getting weaker? Ask them how they feel about their disease process and what their support system is like. There's a good chance we can help them.